Started out as a very small resource center and advocacy group, because way back then, our community wasn't even at the table or even on anybody's radar scope, especially with regard to elders. Our community, amongst Asian elders, 80% of folks speak other than English at home. And over half don't speak English well. And fully 1/3 have no adult in the household that speaks English well. So you can imagine that the language ability is really key. And even if they're conversant in, say, English, making healthcare choices or much more important information, they would much rather have it in language. We reach nationwide. Our helpline and call centers can reach folks in even the smallest communities, because in many ways, those smaller communities don't have community-based organizations with language access, so we're often the only helpline available to them. But we have a couple of employment programs that are really kind of the backbone of our services, and that runs nationwide. We operate in about a half a dozen states in about 30 counties, primarily in Northern and Southern California, Washington State, Houston, Chicago, metropolitan Illinois area, and New York.
The CSEP program, Senior Community Service Employment Program, was born out of the Older Americans Act, Title V. And gist of the program is to employ older adults, 55 and over, that are low income, and pair them in employment training with nonprofits, 501c3s, or senior centers, public agencies, to receive training. Eventually, we hope that they're trained enough and have enough experience to then place them into jobs. And the C program, it is a senior employment program, also using the resources of older adults and their experience. There are many seniors and older adults that are employed through the program, and NAPCA is one of 4 recipients of this grant.
We utilize our network to do community outreach, and we use their venue to host events. So we think these strengthen our partnership with our host agencies as well. So we did a lot of vaccine outreach events last year in 2023. In total, we did 34 events around the country in major cities like Seattle, LA, San Francisco. We administered 3,200 of vaccination, including COVID and flu. And we also received a bunch of media impressions from these events. We also did outreach through our fact sheets and also flyers.
There was hesitancy on the vaccine. We saw it in the Southeast Asian communities. Many of those are refugees who fled communism. They had a big distrust of government in general. I think my biggest hope is that people will see that we were very effective in reaching out to a community that wouldn't have otherwise saw it. We probably reached 15-20 million people in our media outreach, and I think that made a big difference in non-English speaking folks understanding and being de-confused. When we looked at some of the data afterwards, we saw that the numbers were actually better on vaccinations. If you take the time to reach communities that you wouldn't otherwise reach, you really can have a big impact.